Chapter 15. Blood. A full blood count. In the investigation of blood disease, the simplest test is a full blood count, FBC. A full blood count measures the following in a sample of blood: the amount of hemoglobin, the number of the different cells, red blood cells, erythrocytes, white blood cells, leukocytes, and platelets, thrombocytes, the volume of the cells, the erythrocytes sedimentation rate, ESR, a measurement of how quickly red blood cells fall to the bottom of a sample of blood. B. Anemia. Anemia is one of the commonest diseases of the blood. It may be due to bleeding, loss of the blood, excessive destruction of red cells, low production, for example, because the diet is lacking or deficient in iron, Fe. A medical student has examined an elderly patient with a very low level, has hemoglobin, and is discussing the case with her professor. What's the most likely diagnosis in the case? Student: most probably carcinoma of the bowel with chronic blood loss. What's against that diagnosis? Well, that hasn't had any change in his bowel habit or lost weight. What else would you include in the differential diagnosis of severe anemia in a man of this age? Student: he might have leukemia of some sort or aplastic anemia, but that's where it would be very unusual. Another cause is iron deficiency, but he seems to have an adequate diet. Professor: okay, now there's another cause of anemia which I think is more likely. Student: chronic bleeding ulcer? Professor: yes, that's right. But what about pernicious anemia? Can you exclude that? Student: well, he's got none of atypical neurological symptoms like paresthesia. C. Pernicious anemia. Jordi Pons, the medical student from Barcelona, has made some language notes in this textbook. Pernicious anemia, PA, is a condition in which there is atrophy of the gastric mucosa with consequent failure of intrinsic factor production and vitamin B12 malabsorption. The onset insidious with progressively increasing symptoms of anemia. Patients are sometimes said to have a lemon yellow color owing to a combination of pallor and mild jaundice caused by excessive breakdown of hemoglobin because of ineffective red cell production in the bone marrow. A red sore tongue, glossitis, is sometimes present. Patients present with symmetrical paralysis in the fingers and toes, early loss of vibration sense, and progressive weakness, and ataxia. The spleen may be palpable. Onset beginning. Insidious, slowly developing. Pallor, lack of color. Mild, slight. Jaundice, bilirubinemia. Breakdown, division into smaller parts. Bone marrow, soft tissue in the cavity of bones. Symmetrical, each side the sum. Vibration sense, ability to feel vibrations. Progressive, continuing to develop. Palpable, can be felt with the hand. (15.1) Find word in the box with opposite meanings. Adequate, inadequate. Against, for. Unlikely, likely. Severe, mild. Rare, common. Sudden, insidious. 15.2 Make word combination using a word from each box. Bone marrow, differential diagnosis, insidious onset, iron deficiency, pernicious anemia, progressively increasing vibration sense. 15.3 Complete the sentence. A 39-year-old man presented with a history of progressively abdominal distension over a period of 6 months. Bleediness may be caused by vitamin A deficiency. The bleeding and purpura are caused by a normal platelet function. The white cell count is normal, so we can exclude acute leukemia. The yellow color of her skin and conjunctiva is probably due to the jaundice. There was a palpable mass in the right upper quadrant of the abdomen. Treatment is aimed at restoring fluid balance with adequate intravenous fluids. The anemia may be due to increased red cell destruction. 15.4 Complete the conversation. Professor, what is against to the diagnosis of pernicious anemia on physical examination? Student, the problem started quite suddenly, so it didn't have the typical insidious onset. He doesn't have any skin color, and he doesn't have symmetrical paresthesia or absent vibration sense, and I could feel his spleen. Professor, what about his tongue? Student, his tongue was normal and not inflamed or sore.